Chapter 35, Family Interventions. Wrapping up this term, our objectives for this module are going to be to discuss the characteristics of a healthy family, identify family structures, and differentiate family patterns of behavior as they relate to 5 family functions: management, boundaries, communication, emotional support, and socialization. Characteristics of family function include an ability to provide for the safety of members, the quality of resources and support systems, underlying issues, cultural concerns, and developmental needs. They may also include patterns of behavior and interaction, responses to stressors, an ability to interact with support services, parenting skill, relationships and interactions, and overall flexibility or resilience. The family structure could take many different forms, from the traditional nuclear family to a single-parent family, an unmarried biological or adoptive family, a blended family, a cohabitating family, or anything even an other family. This could be children living with related or unrelated adults who are not biologically or adoptive parents. This includes children living with grandparents or foster families as well. In our case study, the Merchant family consists of parents Trent and Marnie and their 2 daughters, Morgan, age 13, and Heather, age 9. Mr. and Mrs. Merchant are seeking family therapy because they're having trouble helping Morgan, who has ADHD, cope with stress in her social situations. Her anxiety and frustration sometimes manifest as panic attacks that can look like aggression. These attacks set off panic at the parents as well as which additionally compounds the problem. Marnie said, "Just because we're consistent, the right way to handle it, so we just wing it." A second response to stress in the Merchant's household is a certain overprotectiveness that they describe seeing in their younger daughter Heather. In general, they've noticed that Heather tries to compensate by being very well behaved. Like, almost abnormally so, says Trent. "We think she's trying to protect us from more stress." Marnie nods. Sometimes on rough evenings, she even takes control at dinner time, ordering pizza or making hot dogs for dinner when we're focused on Morgan. And she's only 9 years old. It's sweet, but we also feel bad that she thinks she has to do that. Among the family functions include management, boundaries that should be clear, diffuse or enmeshed, or rigid and disengaged. Effective communication, emotional support, and socialization are key. For our first question, the family has come to rely on 9-year-old Heather to initiate dinner preparations when her sister is having an episode. Although this can be a positive, it does mean that they run the risk of violating ordinary family A, boundaries, B, socialization, C, communication, or D, management. In this case, the answer could be A or D. Although children learn decision-making skills as they mature and increasingly make decisions and choices about their own lives, they should not be expected or forced to take on the responsibility of the family. A 9-year-old child like Heather should not be the one to manage meal planning or initiate dinner preparations. Unless this is an occasional learning task that the parent and child enjoy together, it's inappropriate. It can also run the risk of violating boundaries if the child begins to feel an adult's burden to provide meals for her family. An overview of family therapy. Our objectives will be to compare and contrast insight-oriented family therapy and behavioral family therapy. Identify 5 family theorists and their contributions to the family therapy movement. Analyze the meaning and value of the family's sociocultural context when assessing and planning interventional strategies. And construct a genogram using 3-generational approach. The major goals of family therapy include improving the skills of the individual members, strengthen the functioning of the family as a whole, and family systems theory. By altering family dynamics, we can decrease emotional reactivity, increase each member's sense of self, and improve members of the family interaction. Areas usually explored before family therapy include cohesiveness, communication, appreciation, commitment, coping, and beliefs and values. Concepts central to family therapy include the identified patient, who is the individual typically regarded by family members as the problem. The family member whose beliefs, perceptions, actions, and responses demand an immediate fix, sometimes known as the family symptom bearer. Also, family triangles. Triangulation occurs when one family member will not communicate directly with another family member, but will communicate with a third family member. In this case, who is the identified patient in the Merchant family? Would that be A, the dad, B, the mom, C. Morgan, the older daughter, or D. Heather, the younger daughter? And obviously that's going to be C. Morgan. The two paradigms of family therapy are insight-oriented family therapy, which focuses on developing the increased self, other, and family awareness among family members, and behavioral family therapy. This focuses on changing behaviors of family members to influence overall patterns of family interactions. Other goals of the main models of modern family therapy include contextual therapy, which works to gain insight into problematic relationships, family of origin therapy, which fosters differentiation and decreases emotional reactivity, and experiential existential therapy, which guide the family to identify and develop their own solutions to dysfunctional behavior. Other goals could include structural therapy, which works to improve family relationships through restructuring the family hierarchy and boundaries. Strategic therapy, which realigns the family hierarchy through use of rituals, which change repetitive and maladaptive patterns. And finally, cognitive behavioral therapy, which improves patterns of negative behaviors through changing thought patterns. In this question, experiential existential therapy is an example of A. Insight-oriented family therapy, B. Behavioral family therapy, C. Family system theory, or D. Triangulation. And that answer is going to be A. Insight-oriented family therapy. This focuses on developing increased self, other, and family awareness among family members. Behavioral therapy focuses on changing behaviors of family members to influence overall patterns of family interaction. In this case, experiential existential therapy focuses on helping a family identify and develop their own solutions to dysfunctional behavior patterns. The application of the nursing process. Our objectives would be to recognize the significance of self-assessment to successfully work with families, formulate outcome criteria for families, identify strategies for family intervention, and distinguish between the nursing intervention strategies of a basic level nurse and those of APRNs with regard to counseling and psychotherapy. Family assessment can include sociocultural assessments, assessment tools such as constructing a genome, and self-assessment. A genogram is an efficient clinical summary and format for providing information and defining relationships across at least 3 generations. By creating a genogram, nurses and therapists are able to map the family structure and record family information that reflects both history and current functioning. There could also be family-related diagnoses, outcome identification, planning, nursing interventions, and evaluation. Other outcomes are to reduce dysfunctional behavior of individual family members and resolve or at least reduce conflicts, and to mobilize family resources, encourage adaptive family problem-solving behaviors, improve the family's communication skills, heighten awareness and their sensitivity to other family members' emotional needs. Other outcomes could be to strengthen the family's ability to cope with major life stressors and traumatic events, including chronic physical or psychiatric illnesses. Also, to improve the integration of family system into a societal system. For nursing generalist interventions, they can include counseling and communication techniques. These should come in a non-judgmental manner that promote open and flexible communication. It should also include the perspective of each family member that is elicited and heard. Identify and address indications of stress, promote the family's mental health, and the treatment education. For advanced practice nursing interventions, they should be uniquely qualified to conduct family therapy, manage pharmacological interventions, and apply family therapy to specific disorders. Often a combination of therapies is most useful. Morgan's parents alternate between making up rules as they go along to try to offset a panic attack or tantrum to either restraining, withdrawing, or disengaging when a panic attack begins. Morgan kind of takes control, they confess. Which type of therapy would be most helpful in this particular situation? Would that be A, structural, B, contextual, C, family of origin, or D, experiential existential? And in this case, structural therapy that focuses on identifying patterns. Its goal is to improve family relationships through restructuring the family hierarchy and boundaries, also helping the parents to be much more consistent. Which goal is most appropriate as a first step in helping Morgan and her parents with behavioral problems related to her ADHD? Would that be A, Morgan will develop stress reduction techniques, B. Morgan's parents will provide structure and limit setting. C. Morgan will adhere to the medication regimen. Or D. Morgan will be free of aggressive behavior. And that answer is obviously going to be B. Morgan's parents will provide structure and limit setting. And for our last slide of this chapter, a genogram should include a minimum of how many generations? 2, 3, 4, or 5? And that answer is 3. Bowen proposed that the family is organized according to generation, age, gender, roles, functions, and interests, and suggested that where each individual fits into the family structure influences the family's functioning and relationship patterns, as well as the type of family formed in the next generation. A genogram should include at least 3 generations. Anyway, that's all we've got for this chapter. I'll see you in the next slides.